of what we are.
Uganda's response is heavily dependent on external funding, with donors covering about 80% of the total cost. However, donor funding has reduced over the years. The US alone contributes about 60% of the HIV response funding. The US executive order, issued on January 24, 2025, paused foreign aid for 90 days, already causing disruptions. The Uganda AIDS Commission reports that the freeze has affected at least $350 million of funding, which includes $101 million allocated for the procurement of HIV and TB health supplies and commodities.
So as it is now, when we say it has been affected or is likely to be affected, we are saying if the executive orders are fully effected, that money will not come. When this money comes from the United States government, it is not advanced to government. It is advanced to manufacturers, and some of that money comes in form of drugs. It is advanced to implementing partners, and they sign agreements with the United States government. It is advanced to the manufacturers of equipment and the laboratory supplies.
If the order is sustained, Uganda will see reduction in availability of life-saving ARVs by 30%, laboratory supplies by 70%, condoms by 50%, PrEP commodities by 80%, and male circumcision kits by 100%, although no immediate shortages have been reported yet.
The things that we are using now were ordered 6 months ago or even earlier. And so the things we are using now are in the pipeline, which means that the disruptions that are happening now, we may not see the effects immediately, but a point will reach when we did not order, and therefore we start seeing the disruptions sometime in the future.
Over 29,000 USG-supported health workers will be unable to provide services, disrupting HIV prevention, treatment and care at health facilities and communities. Some of these have already been laid off following the order, but others were retained after the waiver was announced.
Supporting salaries for doctors, for pharmacists, for nurses. However, the majority of those were the foot soldiers, the non-medical people who were able to go to the community and encourage people to come for testing, sometimes be able to deliver medications from the facility to the community for people who were unable to come.
As per the Uganda AIDS Commission data of 2023, 1.4 million people are living with HIV. Of these, 910,000 are women and 510,000 are men, whereas 72,000 are children. The new infections stand at 38,000 and AIDS-related death at 19,000. The US order comes at a time when Uganda is on the road of ending AIDS by 2030. Although the number of new infections is reducing, the rate has stagnated.
The Ugandan HIV landscape is going to get worse. And we have done a projection from 2010 to 2050. And the blue bars show that if we don't curtail new HIV infections by 2030, it means that we'll continue to get new HIV infections. And by 2050, we'll be having more than 1.5 million people.
The experts say there is urgent need for transitioning from donor-funded to government-led domestic HIV response while ensuring the gains made are not reversed. Norbert Atkunda, NTV Tonight.